Okay, we're back. We've already done our public comment.
Unmuted.
This morning, I apologize, I purposely avoided commissioner comments because we had all the people there, and I was planning to go back to it, and I never did, but...
Yes, but I think before you get started back again, we just need to state that we did meet in executive session, and that now has been concluded. I would like to correct for the record, we did not have Elise Elder in there, but we did have Mr. George Stokas in the executive session along with the others that I mentioned.
Okay.
Now you can...
Now we can... Commissioner comments, so... Commissioner Smith?
I'm all set for today, thank you.
Commissioner Heatherton?
Yes, I want to revisit the ordinance that we talked about last week on face coverings. For clarification, Section F,
Hold on a minute.
yes?
Ms. Woods would like to speak.
Yeah, with respect, Commissioner Heatherington, we have a active litigation considering the ordinance. So I'm not sure what you're going to say, but I would ask you to, if we could have a conversation so that we don't have a discussion that would in any way jeopardize our defense of the legal challenge.
Okay, and I'd like some clarification on a section of the face covering ordinance.
Oh, okay.
Section F, I thought we had talked about taking that out, but that was never amended in the motion. Is that correct?
Section, I'm just finding it.
On
Excuse
page
me.
7.
As I recall, and I could review the tape, but I believe that the motion maker did not agree to it, that the motion maker...
Yeah, they have no idea what you're talking about.
If FI is persons who have a medical condition or disability that makes wearing of face coverings unsafe, and then there was a section underneath it, I, that said that when a person asserted he or she has a disability that prevents the individual from wearing a mask, the owner, manager, or employee of a business or establishment may exclude the person, even if they have a disability, as they pose a direct threat to the health and safety of the business of the establishment, shall reasonably accommodate the disabled person in a manner that does not fundamentally alter its operations or cause undue hardship or jeopardize the health and employee of the customer. I'm not sure if the board remembers that discussion, but as I recall, there was a discussion about it, but I think the motion maker, Commissioner Hurd, didn't agree to that being taken out.
I think I remember that too.
Yeah.
I'll be happy to review.
I remember Commissioner Smith and I having a dialogue.
Because I just did those minutes. Yes, there was that discussion, but Commissioner Hurd amended her motion to specifically say that Section I remains and the signage language stays the same. She specifically added that to her motion after your discussion of the paragraph.
So this is something I've heard an immense amount of feedback from residents and from businesses that are confused. And is this something that we could amend and revisit? All right, then I will move that we reconsider the ordinance.
I don't see a second, so that motion would fail.
Well, I can say I'm disappointed because part of this discussion we had last week, and there was a lot of head nodding, was that my colleagues and I were going to take the onus in this county into educating. One of the things we had a conversation about was having a press conference with all of the new data that we had, and no press conference, no one was available. And how are we going to get through this if we are not providing the data? None of my colleagues were available for that press conference, and I'm quite frankly disappointed because you all shook your head and said, yes, we are going to do this. And I would say this is the first time that I've been sitting up here that I've been really, really disappointed at the way this played out, and I don't feel like there was any intention to ever provide that data. So my question then is, we have all this new data, how are we, the biggest thing I hear is people are fearful because they don't have enough information. So how are we going to provide that? Are we still going to try to do a press conference? What is the plan?
Commissioner Campy would like to comment to that.
Thank you very much. Commissioner Hetherington, I did hear from Ms. Krista on Thursday about I remember during our meeting on Tuesday that we discussed a Friday press conference. I did have a conversation with Ms. Krista on Thursday and did tell her that I was available to participate in the press conference. Just let me know when that press conference would be. I didn't mean that I needed to speak at the press conference, but I would have absolutely been there to stand in solidarity with whoever was going to speak. I do remember the conversation in terms of Commissioner Jenkins and you both saying that you wanted to have additional information from the Cleveland Clinic Hospital, Martin Health, our medical providers, and that there was new information. I did read emails from Ms. Woods that stated the hospital had begun to address the issues that you and Commissioner Jenkins had. I did see a new version of our dashboard that is put out daily. I did read that there was a lot of positive feedback from people that were pro-mask and anti-mask mandate. I won't say that the folks that, I don't want to categorize the folks that most of them were anti the mandate. Even some of those folks on the email responses or the social media responses did speak that they were happy with the new information. I'm not opposed to press conference. I completely agree with you that the more information that we can put out there for the public who is interested and willing to see that information is accurate, the better. And in regards to not seconding your motion for reconsideration, I think that's a slippery slope, because if we start to get back into the conversation, there are members of our community on both sides of the issue that would feel that they were not aware that we would have brought it back up again today. I have not received any complaints from folks that felt there was some confusion in regards to if you entered into an establishment and felt that you had a medical condition that would not allow you to wear the mask. If anything, there are a couple of different Facebook or social media platform pages that people have expressed, very positive experiences. I'm not saying 100%, but very positive experiences that the process is working well. My only concern about bringing it up again is that it would go against what your ultimate goal would be, which is to educate and inform and give information that people could use that's consistent. I think we're there. There is also a frequently asked questions document that was put together that answered a lot of these questions. I think those are the strategies that have made this okay. Plus, I think the businesses and the customers in the businesses, our residents on both sides, are starting to understand this. And I haven't heard, I read one thing where one person went into a business that wanted them to wear masks. The customer did not feel that they wanted to have a mask on, and they said that they could assist them, but it wasn't going to be in person in the establishment. Other than that, I think we are so far so good in terms of it, and that's why I didn't want to second your reconsideration. It opens up a process that can be addressed if there is concern through individual education, not opening it up again. Thank you.
So just moving forward, I think that media coverage is only covering positive cases. So we have to be able to take the hospital data and present it. Whether we do it in a press conference, whether we do it, I love our informational videos, but we have to get a broader reach out there. So the only way that I see that we can do that, and I know that it allows social media a lot of critiques, but if that's the path we went down, then we're gonna get a lot of critics. So the only way that I see that we can get that data out, because the media is only reporting a section of the data, so we have to be able to have a press conference to present that. The other thing that I would ask too is that some of the data that we're getting from the hospital, I think it would, if we can extrapolate that data for the ages of school-aged children and provide that to our school district in a format that is useful, I think that would probably be really helpful to the school district as they move forward. Again, I think there's some of that data that is coming in that pertains to school-aged children, and if we can provide that data to the school district, I think that would be helpful moving forward as they make their decisions.
That would
I'll
be-
check. I don't remember seeing ages anywhere,
well,
but
that would be Department of Health.
yes.
And I
Well, the cases are lumped in age.
realize that, but they're not in that. That's just strictly, well, what we changed is the hospital data. I guess the hospital would have pediatric.
Oh, so they wouldn't be
It wouldn't be
reflected.
in our,
Cases under that age wouldn't be reflected under,
If it's a
Cleveland Clinic.
pediatric issue, I think Commissioner Campy's right, they probably would be, depending on how ill they are, they would be going to a pediatric ward.
I think Mr. Lord had said in the past that children, patients under the age of 18 or whatever would go to St. Mary's in Palm Beach. Not to say that we can't have St. Mary's in Palm Beach give us
that data.
the data for Martin County residents. I agree, I've seen the emails that are coming asking about school district. I just assume the school district and the school board and the school district have the same ability to reach out to Cleveland Clinic and St. Mary's to get that information so that they can make educated decisions. I
Yeah.
don't know if I would want it to come through the county to the school district. They can
Well, as
ask
long as
that.
they're aware of the data that's available, and I didn't think of the St. Mary's, but I think that is really pertinent and valid information for them to have to consider.
They are, the school district, we meet every Monday morning, Incident Command, and Chair Jenkins is there, and the school district is there. So we put this data up on the dashboard and talk about it every Monday morning with them. They indicated at our meeting yesterday that the order that has come down relative to opening the schools clearly states that the Department of Health and the school district will work together on those protocols. And so I know they are working with them. We can check and see if they've got that data and recommend that they, get it from the hospitals. The hospital's at that meeting too. We had a representative there from the hospital as well. So I think that would be a good place to have that conversation
I'm
on
surprised
Monday.
now that we've talked about this, I'm surprised that conversation really hasn't been, yeah. So,
So we'll bring it up with them.
Okay. And one more, I actually just wanted to mention on a positive note that I wanted to thank our Golden Gate Neighborhood Advisory Council and our Community Policing Division that works in that area. We will be walking the neighborhood tomorrow at 5 p.m., giving out masks in the neighborhood, and it was truly a group effort. We discussed it last night. We've got boxes of masks, and we will be walking door to door tomorrow at 5 p.m. to distribute those.
And we've been distributing them through our library system, and that's been very successful. We've actually been able to work with our clerk's office to get a reassignment of some of staff so that they can assist us with that effort.
and the sheriff is also.
Yeah, in the chambers and the,
Chambers of
yes,
Commerce, yeah.
yes.
Yeah. Okay. You done?
Yep.
I want to thank Martha Ann and Taryn and everybody that was involved with putting this chart together that we've got. Heather
Heather.
from Fire Rescue. It was kind of a long, arduous process, but we got there. And I honestly, I mean, there's a few people that always have some issue with it, but 99% has been positive. I think they did a great job. They worked. I got to see how hard it was for them to get this all together.
Yeah.
And I'm sure with all the personalities sitting up here giving input too, it's not easy.
Well, and we are going to be pushing this out on a daily basis at 4 o'clock in the afternoon. So the residents can, and Martha Ann and Laura will message that out. We also are getting the software upgrade that you asked for, where if you're on the chart on your computer, you can go in and hover on like the bar chart, and it will tell you the number.
Well, I think you can do that on a desktop now. What we bought, or what we're talking about, is for iPads and
Okay.
cell phones and stuff, yeah.
Is that right?
So,
Yeah, I couldn't either.
Right, yeah, but on a desktop you can, and it shows now, but, which I didn't realize until I saw your post that replied to somebody that was asking about it. So I said, oh, look at there. So anyway, you guys did a fabulous job. You really did. It's, and this is data that, we can actually make some decisions on in the future. So I think it's what everybody was asking for, and I think we did it. So Commissioner Campy, you good? Commissioner Hurt.
Yeah, we've had so many disasters since March. It's, we've just rushed headlong from one to another with no end in sight, and something that I've noticed that I've wanted to bring up ever since probably mid-March, but it just didn't rise to the level of the emergencies that we were experiencing. And that is that I talked to people in my district and around the county, and have you all been experiencing a lot of coyotes? So we have been in my district, and I remember, I think it was about 6 years ago, Commissioner Smith, we had a presentation that was just fantastic. I can't remember if it was Kylie Yanchula or if it was a Fish and Wildlife woman, but she gave us a really fantastic presentation on coyotes. And given the number of coyotes and given people's misconceptions about coyotes, I think that at some point, it's certainly not urgent, I would love to see another presentation on coyotes. They're present in every state in the United States. They flourish just as well in urban environments as they do in rural environments. So I think it would be really good to have that coyote presentation
Okay.
again.
Yeah, we've had a mass cat missing scenario in our neighborhood here over the last 6 months. So, yeah. And
What
they're
kind of
actually,
scenario?
huh?
What did you say? What kind
Cats
of cats?
have been disappearing mysteriously. And they're getting pretty brazen too, standing in the middle of the driveway in the front yards and stuff. So, yeah. So, is that it?
That's it.
Okay, we have reached the end of our, yes, ma'am.
I'd like to mention something with permission from the chair. During the lunch break, Mr. Donaldson and I met, and we were talking about some other ways to address the Hope Heights issue. And so with the board's head nod or agreement, we came up with the idea of, and because we're under a state of emergency in that area, of coming up with an emergency order that would allow the residents displaced due to the flooding as they're working on their homes to live in a recreational vehicle. And there would also be coordination with the health department so that we met all of the standards. Mr. Donaldson indicated that there may be some folks that would like to avail themselves of this. What we would do is have Ms. Krista do an emergency order, which my office will draw up. And then what we will also do is work going forward to amend the LDRs to allow for this kind of thing in the event of an emergency, that there would be a temporary ability when people are displaced. It would be very, very narrowly driven, but when you're under a declared state of emergency, to allow some relief. So
I think
with
it's a
your
great idea.
authorization,
Yep.
we'd like to have that
Plenty of
authorization
head
to go
nods up here.
forward.
Just
Yeah.
another great option for people that want to be there and.
We've had a request.
Yeah,
Excellent.
yes, sir. Thank you.
Great.
So I wasn't sure, Commissioners, how you wanted to proceed. Initially, we had the conversation, too, about our Friday meetings and not meeting on the same weeks that we have regular board meetings. Sometimes I feel like some folks are getting meetinged out. So I wasn't sure if you still wanted to have a special meeting this coming Friday, knowing that on Monday you're going to start your budget workshops. So I'm just throwing that out there.
Sure.
Mr. Chair, I remember Ms. Kristen and I just had this conversation earlier, and we talked about if we were having a meeting like we did today, that we wouldn't have to meet twice in a week. And then you had said that maybe I was the one that suggested that we go back to an every Friday. I think one meeting per week is appropriate to, like, for instance, today is a Tuesday, for us to come back on Friday to have another conversation. If something super urgent happens in the community that would require us to do that, I think that's appropriate. But just to have two makes it difficult for our residents to follow along on when they should watch to hear important information, and for us to continue to put the staff all together instead of allowing you to have opportunities to do your actual jobs instead of talking about doing your jobs. And from a commissioner point of view, I think once a week
I
is
concur.
appropriate.
I have a question. So if we would have a surge this week, and it's possible because it's the timing after July 4th weekend is appropriate, could we, because we already have a meeting scheduled for Monday, could we, if it's necessary, include an update on COVID-19 at the
Oh, sure.
beginning of the meeting?
It's a budget,
Okay.
yeah, absolutely.
Just responding to changes. Okay.
So we are or we are not meeting this Friday?
We're not.
No, we are not. There's potential for a discussion on Monday before your budget.
Got it.
What?
No. It's the same thing.
Yeah, let's do it on a week by week.
Yeah. Yep.
Right.
Okay. Any other comments? Okay, so that means our upcoming board meetings are July 20th and 21st are our budget workshop meetings, and July 28th. Okay. July 20th, and if we need the 21st, will be our budget workshops, and July 28th will be our regular meeting. And if nobody's got anything else, we are adjourned.